Hello, I'm Dr. Jeffrey Tate. In the next few minutes, you will learn important information about Adult Attention Deficit Disorder, ADD for short. First, let me ask you, do you feel disorganized nearly every day? Do you have trouble finishing things you start? Do you often get distracted away from what you should be doing and then don't get back to it soon enough? Have you been this way for about as long as you can remember? If you answered yes to two or more of these questions, there's a good chance that you're suffering from Adult Attention Deficit Disorder, ADD. Recent studies estimate that one adult in every 25 suffers from ADD, so adult ADD is about as common as asthma. Fortunately, there are treatments for ADD that usually improve all these problems by 75% or more. Most adults with ADD have 3 or 4 of these symptoms. Do you? Difficulty paying attention to tasks that are important but not entertaining. Quick boredom that can be very severe and even painful. Starting many projects but leaving most unfinished. Putting off tasks to the last minute. Forgetting things that you need to do. Difficulty listening well. A poor memory of what was read. Impatience and impulsiveness. Irritability and angry outburst. Fidgety, restlessness, hyperactivity. Individuals with ADD have great difficulty starting, focusing on, and completing all the little tasks that are a necessary part of life but are not very entertaining or interesting. These tasks include things like balancing the checkbook, paying bills, really completing the laundry, completing routine office paperwork, writing a report for work or college, studying for a test. These are the kinds of tasks that are essential, but they're not interesting or entertaining. The person with ADD procrastinates starting them, quickly interrupts work on them, gets distracted by something more interesting and drifts off track, or rushes through them doing a sloppy job. Part of the problem in completing tasks is quick boredom. Of course, we've all experienced boredom on occasion, but the boredom of someone with ADD is much more intense. It can be so painful that it's literally impossible for the person to continue doing what he's doing. This boredom makes it very difficult to finish a project, even an initially interesting project, if it extends over several days. Therefore, many individuals with ADD start lots of projects but leave most of them unfinished. This boredom can make it very difficult for college students with ADD to go to class regularly. It can even make it difficult to stay in a good job or in a good relationship. The distractibility of ADD can make even carrying on a conversation difficult. The person with ADD will often realize that she has no idea what someone has been saying to her for the past couple of minutes. Instead, her mind has been wandering to a daydream or just skipping ahead to what she wants to say. This can make the other person feel completely ignored, and it can make listening in class to lectures and taking good notes very difficult. Some individuals with ADD habitually interrupt other people who are talking because they know that they'll forget what they want to say if they wait to say it. These listening and conversing problems can make communication with others difficult and can cause problems at work and in marriage. Other people feel ignored and then get tired of being interrupted. The same kind of thought distractibility can also make reading difficult. The person with ADD will suddenly realize that he's read an entire page but hasn't really read or paid attention to a single word. Now, some adults with ADD have no trouble reading entertaining magazine articles or novels, but textbooks cause them problems. For about 1/3 of adults with ADD, other emotional and behavioral symptoms are present. About 1/3 of adults with ADD have trouble with poor impulse control. When there's something they feel the urge to do or to say, they just do it, even if it will result in bad consequences. If someone makes them angry, they tell them off, no matter what the consequences. If they see something they want, they buy it, no matter the price. If they get upset at work, they may even walk off the job. Closely related to this poor impulse control are anger outbursts. When frustrated, the adult with ADD may become overly angry and strike out verbally. About 1/3 of individuals with ADD have emotional highs and lows that are too extreme. When something happens that makes them feel good, they become overly excited, thrilled, and fired up. On the other hand, when something happens that makes them feel bad, they may feel horrible, worthless, angry, hopeless, and hate themselves and the world. Now, an hour later, they may be fine again. This is why the most common misdiagnosis among adults with ADD is bipolar disorder. The ups and downs, though, of true bipolar disorder are usually of much longer duration, weeks or months, than the brief mood swings of ADD, which are minutes to hours. Finally, some, but not most adults with ADD suffer from hyperactivity. This means that they cannot sit still normally. In its mildest form, there's constant foot tapping. Constant pencil tapping, finger drumming, and squirming in the chair are common signs of hyperactivity too. In the severe form, hyperactivity causes the person to be unable to sit at a desk, to sit through a meeting or a church service, or to relax and watch TV. They must be constantly up and going. Often adults with ADD tell me that school was difficult, especially in the upper grade levels and in college. They may have been labeled as underachievers. Now, some adults with ADD did okay in school because they never really had to study, and maybe they took easier courses in college. But even they will admit that they could have done much better if they had applied themselves. As they move out of school and into the more complex world of work and marriage, ADD symptoms begin to cause greater problems. In their work careers, individuals with ADD have to work longer hours to keep up, and at home they often feel disorganized and always behind on what they need to do. Normally, inattention, procrastination, distractibility, and poor reading concentration should not be daily problems that hold you back in school, at work, or in accomplishing things around the house. When these are daily problems, ADD is the most common reason. ADD is definitely not just normal inattentiveness or laziness. Willpower, attitude, and upbringing seem to have little or nothing to do with it. ADD is clearly a medical disorder with a definite medical treatment. The most powerful treatment is medication to increase the brain chemical dopamine, which is a normal chemical in all of our brains. Experience has shown that non-medication treatments, such as counseling, have almost no effect on the long-term symptoms of ADD. ADD medications have been in use since the early 1930s. All the evidence is that when taken as directed, they are safe and are not addictive. The medications are safe in children and are even used during pregnancy. Their side effects are usually minimal. The medications are safe to take lifelong if needed. Now, what can a person who has ADD expect from taking medications? Usually, within about 30 minutes, thinking is clearer. Thoughts seem less jumbled. There's a feeling of wanting to start tasks that are important to do. There is less boredom and it's easier to finish projects. Thoughts are well focused and distractions are less of a bother. It's easier to remember what you need to do. It's easier to keep your mind on what you're reading and to remember what you've read. Conversations are easier to follow and to remember with less interruptions. If the problems I've described fit you, then you should probably find out if you meet the diagnosis of ADD and could get treatment. Here's the most important question to ask yourself. Do I have problems starting and completing tasks that are important but are not entertaining or interesting? If you see a pattern of this throughout your life, neglecting, procrastinating, rushing through at the last minute, leaving incomplete tasks that should have been done sooner and better, then you need an evaluation for ADD. Treatment will mean better organization, less time spent at work, better career advancement, fewer hassles due to forgetting appointments and tasks, less cramming at the last minute, easier learning. You'll feel less overwhelmed and more in control of your life. For many individuals with ADD, treatment will mean less depression and anxiety, and better relationships with spouse, boss, customers, and coworkers. Come see me for an evaluation appointment. A simple medical history is usually all that's needed to make the diagnosis and start treatment. Only rarely are psychological tests required. Treatment usually involves only taking a simple and safe medication. You can usually start treatment and see improvement within 24 hours of our first visit. I'm a board-certified physician, and I've been on the teaching faculty of 3 medical schools. I have the most experience in the evaluation and treatment of adult ADD of any physician in Northwest Arkansas. In fact, only a handful of physicians in the entire U.S. have as much experience in adult ADD as I have. My success rate in treating adult ADD is well over 90%. This means you have the best chance of getting the right diagnosis, the right treatment, and the best outcome without wasted time or money. Patient service at my clinic is the very best too, including very short waits. You always have easy access to me personally via email or phone. Satisfaction rates on our frequent patient surveys are nearly 100%. In fact, I give a 100% money-back satisfaction guarantee. So act now. Go to tatehealthcare.com, my website. From there you can call my office at 800-889-4319 to request an appointment, or you can email me at jtate@tatehealthcare.com to ask me a question or request an appointment. At my website at tatehealthcare.com, you can also complete an online symptom questionnaire that I'll evaluate and send you via email my personal assessment. Do it today. I'm looking forward to helping you lead a more successful and fulfilling life.